Good day everyone, I am Joanna IVM Ramos from BSN3 Block D, a student nurse from the College of Nursing at Nueva Ecija University of Science and Technology. For today, I am going to demonstrate oxygen saturation measurement using the pulse oximeter.
So what is a pulse oximeter? A pulse oximeter is a device that is used to quickly and easily monitor a person's oxygen saturation. It can measure the level of oxygen within the blood, specifically in the arterial blood, without using any invasive measures. In addition to measuring oxygen saturation, the device provides a heart rate measurement as well.
So, the goal for using a pulse oximeter is the patient exhibits arterial blood oxygen saturation within acceptable parameters or greater than 95%. The equipment we should use is the oximeter. Oximeter probe appropriate for patient and recommended by oximeter manufacturer, acetone or nail polish remover if needed, pen and vital sign flow sheet or electronic health record if available. So for the implementation of the procedures, first, review chart for any health problems that would affect the patient's oxygenation status. And then next, bring necessary equipment to the bedside stand or over bed table. Next one, perform hand hygiene and put on personal protective equipment if indicated. Identify the patient, close the curtains around the bed, and close the door to the room if possible. Explain what you are going to do and why you are going to do it to the client. And then next, we should select the adequate site for application of the sensor. First one, we should use the patient's index, middle, or ring finger. Next, check the proximal pulse and capillary refill at the pulse closest to the site. If circulation at the site is inadequate, consider using the earlobe, forehead, or bridge of the nose. And then next, use a toe only if lower extremity circulation is not compromised. Next one, select proper equipment. A. If one finger is too large for the probe, use a smaller one. And then next, use probes appropriate for patient's age and size. Check if the patient is allergic to adhesive. Next one, prepare the monitoring site. Cleanse the selected area with the alcohol wipe or disposable cleansing cloth. Allow the area to dry. If necessary, remove nail polish and artificial nails. Next one, apply probe securely to the skin. Make sure that the light emitting sensor and the light receiving sensor are aligned opposite to each other. Next one, connect the sensor probe to the pulse oximeter, turn the oximeter on, and check operation of the equipment. Next, check the oxygen saturation on regular intervals as ordered by primary care provider, nursing assessment, and signaled by alarms. Remove sensor on a regular basis and check for skin irritations or sign of pressure. Every 2 hours for spring tension sensor or every 4 hours for adhesive finger toe sensor. Next one, clean non-disposable sensors according to the manufacturer's directions. And then lastly, remove personal protective equipment if used and perform hand hygiene and document the procedure that you have done to the client.